Hello, Mrs. Smith.
Hi.
How are you?
I'm so good. How are you?
I am great. My name is Viri, and I'm going to be your nurse for today. So it looks like Dr. Smith has put in some IV orders. So we need to initiate an IV on you. And I'm looking at that at the MAR. Before I begin telling you about the process, can you verify your name and date of birth with me, and I'm going to compare it with your wristband?
Yeah, Jane Smith, 102583.
Perfect. Alrighty. So we're going to go ahead and we're going to initiate an IV cath. So I'm going to poke you for a little, and I'm going to advance the catheter in your vein, and then we're just going to put it in for quick access to any medication administration. Is that okay with you?
Yep.
Alrighty. Before I begin, do you have any allergies to latex, shellfish, iodine, betadine, and adhesive?
No, ma'am.
Alrighty, awesome. I'm gonna go ahead and gather my supplies, and then which hand is your non-dominant?
My left hand is non-dom.
Alrighty, I will go ahead and keep that in mind, and we'll initiate it on the left so it's easier for you, okay?
Okay, sounds good.
I'm gonna go ahead and sanitize my hands, collect my supplies, and grab a set of gloves. Alrighty, Mrs. Smith, I'm gonna go ahead and raise you up in bed
Okay.
so I have a better view of your arm.
These dang beds don't work like they used to.
Were you a nurse before?
Oh, I was a caregiver back in my day.
Oh yeah, these fucking beds.
Yeah, I agree.
Alrighty, so I'm gonna go ahead and I'm gonna use a tourniquet, and I'm gonna look for a vein that looks like it could hold an IV.
Okay.
Okay, and I'm palpating for any hard veins, any arteries, any lesions, and it looks like I want to choose this one. I'm gonna go ahead and undo my tourniquet. I'm gonna go ahead and sanitize my hands. I'm gonna apply some gloves. So how long were you a caregiver for?
Oh, I was a caregiver for about 10 years.
Oh, that's awesome.
Yeah.
It is truly appreciated. I truly appreciate what you do.
Well, thank you. And you're in the same boat now, so I appreciate you.
Oh, well, thank you. I'm just gonna go ahead and prepare my supplies, okay?
Okay.
I'm gonna go ahead and open up my IV extension. And I'm gonna go ahead, it's a new IV extension. I'm gonna go ahead and prime. Alrighty, I'm gonna leave that right here for when I need it. And then I'm gonna go ahead and open my kit. Alrighty. I'm gonna set that over here. I'm gonna grab my chlorhexidine, and I'm gonna I'm gonna set this right here. Well, I'm gonna do a tourniquet again, okay?
Okay.
And I'll give you a heads up when I poke you, okay?
Sounds good.
Okay, I'm gonna go ahead and just verbalize that I will cleanse the area for at least 30 seconds. Vigorously.
Vigorously. That sure is vigorous.
Yeah, heck yeah. Alrighty, then I'll dispose of that. Alright, using a new IV Cathlon 22 gauge, I'm gonna go ahead and prepare. Alrighty, Mrs. Smith, I have the IV cath ready, and I'll just give you a warning, okay?
Okay.
Okay, 1, 2, 3. Alrighty, I'm gonna go ahead and occlude the vein. Put that away. I've clicked it all. Go ahead and attach that. I'm gonna go ahead and prime. Alrighty. Go ahead and set that aside. I'm gonna grab my dressing. Was that hurtful at all? Are you in any pain?
No, I didn't even feel it.
Alrighty. Okay, I'm gonna go ahead and I would grab a pen and I would go ahead and put my name, Bridiana Lemus, date and time. You know what? I'm gonna ask you to press your call light so my helper can come get me a pen, okay?
Okay.
Okay, my helper has come into the room. I'm gonna put my initials, VL. Today's date is 2/20.
I think it's the 24th.
Yeah, 24th. My brain is just a little iffy. Then 22 gauge. Alrighty, I'm gonna go ahead and set it right here. Then I'm gonna go ahead and remove my saline and I'm gonna go ahead and lock this. And I'm gonna go ahead and tape it. How are you doing, Mrs. Smith? Are you in any pain?
No, no pain.
Okay, just making sure. I'm gonna go ahead and chevron. And I'm just making sure I don't cover my IV site. Alrighty, that is held in place. I'm gonna go ahead and collect my supplies. And I'm gonna put this in the sharps. And then I'm gonna go ahead and take this all out of the way. I would dispose of this. I'm gonna go ahead and set this aside. I'm gonna go take, oh, I would have taken my tourniquet off too before I put the dressing on. I just wanna verbalize that I would have taken this on immediately at insertion. I'm gonna look at it and I'm gonna inspect it to see if I see any signs of irritation or redness. Then I'm just gonna fix this little site. There we go. Alrighty, Mrs. Smith, how does that feel?
Feels good.
Okay, I'm gonna remove this tourniquet. I'm gonna take the rest of my garbage. I'm gonna go ahead and lower you in bed. Alrighty, I'm gonna go ahead and lower you in bed and then I'm gonna set this aside. And then I'm just gonna grab an alcohol gauze because I wanna make sure that this is still clean just in case, because I believe that you do have maybe a medication due soon, okay?
Okay.
Okay, I'm just gonna grab a piece of gauze. Well, not gauze, but alcohol wipe. Alrighty, that was in the cabinet in there. I'm gonna go ahead and just scrub the hub vigorously for 30 seconds. And I have scrubbed the hub so it's still considered clean and prepared for the next person. And I'm gonna give you your call light. Alrighty, Mrs. Smith, you just let me know if you need anything or if you have any questions, okay?
Sounds good.
Alrighty, thank you. I'm gonna go ahead and document.
Thank you.